Welcome to Engage ICT. I'm Sarah Crespo. The number of people in our area experiencing homelessness has increased over the last few years. It's a problem and it affects many parts of the community. One of the most significant related issues is mental health. There's a lot to discuss, so let's get to it. On our panel today, we have Lacey Cruse, Sedgwick County Commissioner of District 4, retired Colonel Brenda Dietzman, now with Wayfinder Consulting, Regina Hafner of Comcare, Jami Scott of the Salvation Army Homeless Services, and Bernestine Williams with the National Alliance on Mental Illness Local Chapter. Thank you all for joining us. Commissioner Cruse, I want to start with you. There are more homeless on the streets now than when the pandemic began, but how many more? What are the numbers that people should know, and how accurate are those numbers? Can you kind of help us put the data into context?
Well, we are going to be having the point in time count that's happening next week. And so we'll really have an accurate picture, as well as the point in time count can be accurate. So we don't really know the numbers. Let's just be honest. We don't really know how many people are living on the streets right now. I think that when people are driving up and down Broadway or up and down Topeka or Emporia, you see all the folks that are out. And hopefully next week we'll be able to have what HUD considers as the number of folks on our streets. But I think we need to reevaluate that. And that's something that I think could really be improved as far as counting the number of people who are couch surfing, or, living in the non-traditional, what HUD would consider homelessness. And so, Sarah Jane, we don't know. And next week, hopefully we'll have maybe an accurate picture, but that's where we start. We have to figure out what the real numbers are.
Can you just help describe for our listeners how that count is done?
Well, I'm learning. I have never done the count before, so I'm sure one of my colleagues on the call probably would be able to help us out with that. I don't know, Jami, do you have a better depiction of that? Maybe Jami can help us with that.
Sure. So the Continuum of Care gathers staff from local social service agencies and volunteers from the community. And there's a training to use an app which has a survey with questions on it that we can go out and we can start finding people who may be on the street, maybe at the Lord's Diner or some of the other agencies where our population may hang out. We go through the survey with them. If they say that they are not homeless, or that they have had some place to stay over the last night, then we stop the survey at that point. They are not counted. If they said, yes, I'm on the streets or I'm in a shelter, then they are counted. So it's an all-day process. It starts very early in the morning. Generally, Regina, does your team go out around 5 o'clock, I think, in the morning? Comcare?
Yeah, Comcare and the VA. Yep.
Yeah, so we're going under bridges, we're going to social service agencies, local businesses. People can call in to United Way and say, hey, I think somebody is homeless. Have you counted them yet? And we will send a team to go do that. We also partner with law enforcement to do the surrounding areas outside of Wichita. So that hopefully we can get an accurate picture of what is going on. The shelters, though, we actually count our folks by our HMIS system, which is our database. And so all of that information that's on the survey, we've already asked them as we put them in that database. So we just pull those numbers out.
So, Jami, you've worked for the Salvation Army's homelessness services for a while now. Can you give us some context here on how you think we've kind of gotten to this point where we are now? And in addition, how much of our situation now is due to COVID?
Yeah, so things have changed a lot over the years. Thank you for being so nice and saying that I've been here a little while. When I first started in this business, people who were coming to the shelter because they lost a job, maybe they got evicted, but it was really a quick turnaround. You could get a job, save a couple paychecks, and you'd be back in a home by the end of the month. It's not that way anymore. Our folks are dealing with so much. You're dealing with mental illness, drug and alcohol addiction. You're dealing with maybe the loss of a family due to incarceration or hospitalization. Right now, we have 3 individuals in our shelter who are over the age of 70. They're coming to us straight from the hospital. There's just so much more going on. It's not a one issue. It's not a one issue solution anymore. And all of our services have been cut back. All of us are running on very short staff due to COVID. All of us are, our funds have been cut, our staffing. And so it's just really difficult to get people into services as quickly as we need to, because we can't necessarily keep in touch with them or keep them at the shelter for as long as it takes to get them those services. And so then going out and trying to find people and getting them to follow up with appointments and things like that. It's become a lot more difficult over the years.
Is this something like the funds diminishing? Has that just been like a little at a time over the last decade or two, or how much less are you working with? Or I don't know if you have that number offhand, but
So if I can answer that.
Go ahead.
Okay, so like Comcare services the funding hasn't increased since 2008. It's 2022. If you can do the math, you understand that's a pretty big gap in understanding the services. The people that are working as a case manager, specifically an addiction counselor, for Comcare, you make about $40,000 a year. In the private sector, you can make about $55,000 a year. So when you talk about how people are dealing with very acute people, very sick people, and they're doing it for pennies on the dollar, we have to pay our people more, because what we're seeing is a bleeding of employees. Employees are dealing with a very difficult population. If anybody on this call or anybody has ever experienced someone who is an alcoholic or somebody who is bipolar or schizophrenic, or any of us, I mean, we all experience these things one way, shape, or form. We are not immune to any of this. And our people on the front lines, our social workers, our addiction counselors, our homeless providers, they're doing this every single day, and they're not getting paid anything for it. So they're leaving the field. So now their caseloads are triple, if not quadruple, and wait times are extremely long. And so we have people going in and out of our jail who are trying to get well, and then they get out and they can't get the services they need because the wait times are too long. It's called the moment of hope. Once the moment of hope happens, they have to have services, because once that moment of hope is gone, they probably won't come back when their scheduled appointment time is in 4 weeks. So it's challenging to handle a lot of folks who are very, very ill, with the amount of staff who are burnt out coming out of a pandemic. Are you guys burnt out? Yeah. Everybody on this call is probably burnt out. Probably everybody listening too. We're just experiencing something we've never seen in our lifetime before. And we have to be really sensitive to that. So I hope that answered any part of that.
Yeah, thank you. Bernestine, I want to come to you next, and because there are so many intersections between homelessness and other issues. But one of the big ones, and one that we really want to talk about tonight, is mental health. Can you tell us about how mental health crises can make these situations worse, and how, in effect, they end up creating these sort of bottlenecks? That moment of hope being something so important to have right at the moment when they are able to, or when they want to get services for them to actually be able to get it?
Okay, well, I come from a somewhat different perspective, I believe, in that I am the mom of a 40-year-old who lives with 5 different diagnoses. And so I see it from a different lens as a family member that we've been in like panic mode for almost 17 years now, dealing with the housing situation. So I don't know if I could adequately answer that question as far as what's available, because we haven't found resources that actually help my son because of the severity of his illness. I mean, he has bipolar schizophrenia, PTSD, depression, anxiety, insomnia, borderline personality. He has them all. So we just struggle with just the fact that he's alive, you know? So I think I need to pass that on to someone else.
Well, did your son, has he himself experienced homelessness? Is that?
Yes. The entire time we have tried to get him into the supportive housing, and of course, supportive housing, they have guidelines. Well, with all of the diagnoses that he has, especially insomnia, where he doesn't sleep at night, he can't keep the curfews because he has to be out and about. And it's just a vicious circle. At one point, as a family, we actually came together, bought a little house, remodeled it, thinking that this might solve the problem. But what happened was, because my son is not capable of processing things, he ended up inviting other homeless people to come live in a very, very small home. And it just wasn't working, because he eventually even was willing to give up the home to these people, and he was willing to go be homeless so they would have a place to live. So it's been just so frustrating, the whole housing situation. At one point, he was able to get supportive housing, but because of the times that he has been incarcerated, that always comes up to where he doesn't qualify, except the one time they were able to find him housing. But because he did have a warrant out, they came to the supportive housing and arrested him because he had a warrant out. So he did, he did have, supportive housing, but they said that they had to do it. And so, of course, we all know that our jails have become our mental health homes.
Yeah. And that's definitely something that I want to get into a little bit more as the hour continues. Thank you so much for sharing your story. It sounds like from the perspective of someone who is very closely invested in an individual going through this process, that it's just inadequate. The services out there, you guys have just found them to be inadequate to actually make any difference. Would that be fair to say?
Yes.
Well, I want to come back to several pieces in that, but first I have a clip that I'd like to play from a commentary that we aired on KMUW from Eric Litweiler of the Mental Health Association of South Central Kansas. And I'd like to ask Regina to respond to this after we hear it. Let's take a listen.
Every year, mental health organizations, both public and private, save the city of Wichita and Sedgwick County tens of millions of dollars in expenses and subsidies to prisons, police departments, hospital emergency rooms, and more by catching mental health issues in our youth and families before they turn into mental illnesses. And we do this even though many of these organizations receive no financial support from those government entities. With your help, Wichita can begin the slow process of shifting resource allocation away from retroactive treatment and into a proactive schedule of prevention instead.
So one of the other things that Eric talks about in that little segment is that it saves so much money for a business, for example, to be proactive and to prevent issues from occurring than dealing with the problems after they have occurred, and that proactive versus reactive kind of mindset. So Regina, I'm curious to know how this actually plays out in your work. How much prevention can you do? And at Comcare, what else is in the works to prevent more homelessness?
To prevent more homelessness? Oh gosh. Well, as everyone's already said, that unfortunately, a majority of our homeless population does suffer from mental illness, including this severe and persistent mental illness. That SPMI population that has severe impairments in their ability to live independently and their ability to access resources independently, as well as maintain relationships with landlords, families, and as well as professional services that are able to aid them in maintaining housing as well as prevent from homelessness. So there's tons of barriers in early intervention. I don't know if anyone's taken Bridges Out of Poverty, but Lacey, Cruse already talked about those scheduled appointments and the wait time with that, and then working with someone who already has a whole bunch of other priorities. We talk about housing, we talk about incarceration, we talk about probation, all kinds of services that they are expected to attend, in addition to mental health treatment services that we all know is very important in maintaining housing. So, early intervention would be being flexible and providing additional assistance in getting to the intakes, the med provider appointments, the case management provider appointments to help manage symptoms that would then increase their ability to maintain housing. One thing in our direction of mental health that nationwide, statewide, and locally we're pushing is the mobile. So we talk about jails and hospitalizations, and how do we divert that? Because when we go to jail, that impairs our ability to maintain housing or even get into some supportive housing programs, as spoken about earlier. Same with hospitalization. Often, if we are in the hospital getting care and treatment, it is then hard to follow up with housing programs or pay rent or that kind of stuff. So if we increase our mobile intervention services within the community, we would then be able to provide local care and treatment and divert from hospitalizations and jail. That looks like the 988 expansion. That looks like the Beacon Mobile. That would include a clinician and case manager going out to the homes of children. That's a partnership with DCF. And then as well as the adult mobile expansion, our co-responder community policing program, ICT1, and other mobile teams to try and divert and care and treatment in the least restrictive environment, and then provide symptom management that would maintain housing.
So now this is something that we could be doing a lot more of, or is a lot of attention being driven into those sorts of activities right now? Is the ICT one, is that still going?
That is still going. And Commissioner Cruse already talked about some of the barriers. It's funding source, as well as when we expand services that require staff, and getting staff on board and then retaining good staff to provide those services as well. But yes, locally, we are expanding mobile services.
Awesome. So thank you, Regina. Brenda, I want to come to you next because there are a lot of services in place to help the homeless, but a lot of times it is law enforcement that is asked to deal with issues involving unhoused individuals. Can you tell us about your work in law enforcement and what you do now, and just kind of the issue as you see it from your experience?
Yeah, well, I was in law enforcement for 28 years, and then I finished up my career at the sheriff's office for the last 3 years in charge of the jail. And I knew about what was happening in the jail, just working for the sheriff's office. But then when I actually got in there and I actually saw it, it was even more stunning than what I thought it was going to be. And really working towards prevention as opposed to, like Bernestine's at turning the jail into the mental health hospital. That is not the place to get better. It's just not helpful. So we really need to do something different. There's a story out there about getting upstream of the problem, right? And there's a story about a man that sees somebody in the river and he jumps in and saves them, and everyone cheers. And then another person is in the river and he jumps in and saves them. And then all of a sudden everybody's trying to save all of these people in the river. Finally, somebody jumps out and just goes upstream and says, I'm going to go out and find out why all these people are getting in the river in the first place, right? So we really need to think as a community, whether it's private, public, nonprofit, we all need to, our religious, organizations, all of us need to really start to think about being upstream in that problem and fixing the problem, because yeah, it saves money, great, whatever. But it saves so much. I mean, Bernestine, bless your heart, we've been in panic mode for 17 years. And in that trauma, if we could provide the services up front, that would just be huge. So right now, I'm the project manager. We do have an executive director now of the Mental Health and Substance Abuse Coalition. And we are working with community partners, with Commissioner Cruse, among other figures in the community as well, to find those upstream solutions that can help solve these issues. Or I should say, what does success look like? We're always going to have homeless, unfortunately. We're always going to have mental health. We're always going to have substance use disorders in this community. But what does success look like, and how can we mitigate it to something that is much better than what we have right now? And that's what we're working towards.
And do you find for whatever barriers there might be to enacting one of these plans that might get upstream, you can have the monetary argument all lined up that, it'll save money in the long run, here's this one. And then there's the sort of heart-centered argument lined up. I mean, do you have like these different ways to explain the value of doing it differently?
Yeah, I mean, you have to know your audience and who you're speaking with, right? So you've got people that are, they're data driven. Is what you're doing effective? And if you're not, we're not going to even look at it. Is it my heart, right? Or is it the community impact that it has? Because there's so much. I mean, there's economic development that you've got to think about. There's business. And the human capital, right? What we're doing to our people, and these people are family, friends, people that we know, people that we meet. We might have been in the grocery store with them a year ago, and now they've got this problem. So, and the other thing that a lot of times people miss on this, and we know that it's a problem, but the substance use disorders in our community. Most of this great country is dealing with an opioid issue. We are dealing with a meth issue, a methamphetamine issue in this community. Recently interviewed District Attorney Mark Bennett, and he said that 18 to 20% of the cases that are charged, people that are charged within district court, have some meth charge included on their charges. Yeah, so it could be homicide, but it could also be meth. So 18 to 20%. And that's just people who have meth on their person when they're arrested. right? He says that anywhere from between 20 and 40% more than that, crimes are meth motivated. So we're looking in this community at a 40 to 60% of our felony cases in district court are because of meth, or they have some meth component to it. Now that's a problem when it comes to our justice system, but it's also a problem because and Regina might be able to help me because I'm not a practitioner here, my friend. But meth does incredibly bad things to a person's brain. And as a result of that, you end up with some sort of, and I'm going to get the term wrong here, so help me out, my friend, some sort of drug-induced or psychosis of some sort. So correct me,
No,
Regina?
psychosis. Yeah.
There we go. Okay.
Yeah,
Yay.
you have psychosis.
I've been listening and learning. So that's a problem too, because that affects the brain structure, and that is either hard or impossible to solve. So we have to very much get upstream of this problem.
Thank you. Lacey, were you about to say something a moment ago?
Yeah, I just wanted to add on to Brenda's comments. I mean, when we're talking about people in our jail, 70% have a substance use disorder. So people go into our jail, they're there on average 30 plus days, and they're literally just sitting. With COVID, we don't have anybody coming in really doing anything because of restrictions, because of fear of spreading this virus. So it's really gotten worse. So a couple of things, I asked Sheriff Easter the other day, how much are we spending on mental health in our jail? And it's for our mental health pod. We're spending about $750,000. $750,000 is what we're spending just to have that pod. So people go in, they get put in this pod, and they sit there. That's not even talking about the ones sitting there for an evaluation at a state hospital. So what are we doing inside of our jail when people are sitting there waiting around for those who are capable of having services, right? I mean, there are people who aren't. So we have to understand the population that we serve within our jail. But for people that are sitting in our jail, what are we doing to help them with those kinds of things? If they have a substance use disorder, are we able to help them with treatment so that we can treat them inside of our jail so that they don't take up the beds in our community, since the beds in our community for substance use disorders are so limited anyway. So that's one thing I just wanted to add. But I wanted to go back to the co-responder model for a second, because when we look at the numbers of our co-responder model, and we have to remember that this was a pilot that started in 2019. It was a Colorado Springs model that Malachi Winters and Dr. Gallagher went to go check out. There are a bunch of them around the country, but they went and we had this pilot and it worked. And in 2019, it kind of went dark for a second. And then I was like, let's get this going again, because the numbers didn't lie. And the numbers that I have here, 63% of the time, responders were able to solve the issue without taking them to jail or the hospital, 63% of the time. So as a commissioner who is responsible for over $450 million, and let's add on the $200 million with the CARES funds and the ARPA funds over the last 2 years, I want to stop budgeting for consequences. I want to start budgeting for getting people out of our jail system, out of these issues in the first place, because if you want to talk money, fine. Let's talk. Yeah, it is way cheaper. But if you talk about how the family structure, and like Bernestine, I have, a real stake in this game. My dad, my daughter, my family history. Like, I think a lot of you have kind of heard, my story, so I'll save you from hearing it again. But this affects me personally. This is like a personal thing for me. And that's why I'm so passionate about it. And that's why I really engage in these conversations and understand that as someone who has money, like my hands on these purse strings, like I see a better way to spend it. And I'm so sick and tired of budgeting for consequences. I want to budget for results that work for families, so that children understand that their parents are trying to heal and that the cycle doesn't just repeat over and over and over. Our society, that's what we're doing. And I hope that we can understand that there is a better way. And this plan that Brenda and Misty and all the folks at the University of Wichita State University and the Substance Abuse Coalition, I cannot wait for this en banc meeting, because they have put together the most incredible plan with, it is so good. I won't spill the beans, but y'all better tune into that en banc meeting, because we're about to lay down some stuff for y'all.
When is the bean spilling happening?
24th.
On the 24th of February.
From 9 to 11, yes.
We'll be tuning in. For those just joining us, I'm Sarah Jane Crespo with KMUW, and this is Engage ICT. We're talking about homelessness and its intersections, especially with mental health. On our panel is Sedgwick County Commissioner Lacey Cruse, Colonel Brenda Dietzman of Wayfinder Consulting, Regina Hafner of Comcare, Jami Scott of the Salvation Army, and Bernestine Williams with the National Alliance on Mental Illness. Brenda, I want to come back to you. Have you witnessed new ways that business, law enforcement, and local government entities have gotten involved in finding solutions to these problems? I'm gathering that there's a lot of kind of research and collaborating that you're involved with here. Do you see more collaboration happening here in our area, and what else is needed to progress?
Oh my goodness, yes. One of the things that I found is that the coalition and the providers, or the practitioners that are out there right now are really, they're really struggling, but they're really trying to work together well. And my goal has always been, even way back in my community policing days when I was a community policing sergeant, was I want organizations to do what they're great at, what they're passionate about, as opposed to just everything that needs to get done or everything that they're good at. And let everyone start to work together so we can do the things that we're passionate about, things that we're great at, and really get the help that people need in this community. So one of the things that the coalition has been able to do under a lot of incredible leaders, we've got a website out there, it's MHSA, so Mental Health Substance Abuse Coalition.org. You can go in and look at the leaders there that have helped. And this is everyone from elected officials to public sector individuals to private sector individuals. We have a lot of people from the private sector that are involved with the coalition, as well as the practitioners, the nonprofits, our great folks at Comcare have all really come together, and we're starting to see some community solutions, which is what's needed, right? Because this isn't just one person's problem, it's our problem, and how are we going to fix it together? So we've really started working towards a lot of different things. We're working on working with United Way with a dashboard so people can get to the very best provider as quickly as they possibly can, just by trying to navigate the 211 system. We're working on getting a database put in place. In fact, the decision on that's very, very close. I'm going to finish up the application for that tonight. And hopefully by the end of the month, we will know that we've been accepted to get on this. And basically what it allows organizations to do after, of course, the person has given consent, to allow providers to know where that person has received services throughout our community, so they can better work together, so the case managers can better work together to provide that kind of wraparound services for the individual. We're also working on some barriers that have occurred within our community, and that can be financial, it can be communication. HIPAA is very needed, but it also gets in the way of things sometimes, of getting people the help that they need. So, how do we work as a community to overcome that by having like a universal release that so providers can share with everyone? And of course, the big thing that we're working on is our service center hub, which will provide in one area treatment services, educational, vocational training, housing, intake services for homeless, emergency shelters, medical and mental health care, substance use disorder treatments, ID recoveries. So if someone needs a driver's license or a social security card, they can go and get that. Just, resume writing and just all of it, and have it in one place.
Grocery, daycare, all those like basic things.
Yeah. So yeah, absolutely. I feel like I'm droning on here. So thanks for jumping in. But it's, there's a lot of things that we can be doing and that we are doing. And some very exciting things are going to start happening in this community. And I think, we have an opportunity with the COVID money, with the ARPA money that's coming down, the Spark money, to potentially make a really big impact moving forward, so we can get more upstream of this problem.
What you all have been talking about so far just makes me want to kind of do a rapid fire around the room here of what would be like your favorite, either little change or it could be a big change, but like what thing would you love to see that you think would just really help to mitigate this issue in our community? Jami, let's start with you.
Okay, so we run a family shelter and single women. So the thing that I would like to see happen with emergency shelter, we can keep people 28, 30 days. We need longer than that. We need to expand that and allow people to feel stable and to be able to get the services they need and to have that support right there around them to be able to start taking those steps forward. So when we do get them into permanent housing, when we do make that step, they're ready for it and they feel confident in that.
Thank you. Bernestine, how about you?
I think the thing that would serve family members better is the universal form that was just spoken of, because if you have a family member that's in total crisis and there's a bed available, but yet you can't advocate for that person, then that bed is gone. And you might have to wait 6 to 9 months before you can get a bed in that specific mental health group home. So I think something, I'm excited to know about that.
Thank you. Regina, how about you?
I'm going to go big picture here, and I say community education. Just having our Wichita community understand homelessness, the professional resources that are available, and as well as their impact on the homeless population, and the difference between referring versus providing, and just community education. That's what I would go with.
Commissioner Cruse?
I'm going to go with Regina. Big picture thinking. Back when I first got started in the private sector, I worked in senior living. And in the 90s, it was all about long hallways, fluorescent lights, cinder block walls, and tile floors. And then it changed to assisted living. And it was nice colors on the walls and, lamps and comfortable furniture. We changed the way that we handle and care for our seniors in this nation. And we should change the way that we care for mentally ill folks. We don't have to be so institutional with things. We can treat them with care and kindness and dignity. When I took my father in, it was, how much money do you make in the big, open room? Nobody wants to talk about their finances in an open space. Just because they're mentally ill doesn't mean they don't deserve privacy and dignity and respect. I think that we have to change the way that we look at mental health, that we look at substance abuse, because it affects every single person, rich, poor, black, white, brown. It doesn't matter who you are. I mean, we all know someone, as I mentioned earlier. So I want to reimagine. Let's reimagine mental health and substance abuse. Let's reimagine it in the way that we can treat people so that they walk into a place that is conducive to healing, that is conducive to, a comfortable atmosphere where people are caring for you. And I feel like, it starts with more people doing the work so that our providers aren't so stressed out and, thin. But I think we have to reimagine mental health at all levels. And to reiterate Brenda's point earlier, it is such a community effort. We all bring different talents to this table. We all bring different things, which is beautiful. Like we all have different things that we can bring. And I hope that we'll value that and understand that this isn't a zero-sum game. There's no one person that is leading this charge. This is every single person putting their efforts in every single day, because at the end of the day, we are not good unless we work together, right? What is it? We're only as strong as our weakest link.
Mhm.
Growing up in sporting events and doing volleyball and basketball, it was like, how can I help the team? How can I not really worried about how many points I make, but how many assists I can have. And that to me is reimagining how we handle this and just rewriting the script.
Thank you. Brenda, how about you? Is there another genie wish that you would like to choose for this?
I have two. So I'm going to talk real fast here. I think coming from law enforcement, first of all, and coming from the jail, the jails become the mental health hospital or where people go, right? And we've got to stop that. And the problem is that we, right now in our jail, in Sedgwick County Jail, there's 85 practitioners in there that are either medical or mental health. We have our own pharmacy. That is the size of probably most people's kitchen. It's huge, right? We have an entire clinic. We have an entire little hospital up there. We have 9 private rooms that people stay in when they're sick in our jail. Here's the problem with that though, right? We can say, and this is what the sheriff has to deal with. Do I have, because I have this captive audience, right? Do I really robustly build up that mental health and substance use treatment? And that way, but if I do that as the sheriff, then who else is going to take that on? Because we're already doing it. So it's kind of it's a really tough spot. So my hope is that we can not be the mental health hospital, and that it gets outside of the jail, and that people who need to be there are there, as opposed to this is the only place that we have to take them. And oh, by the way, they committed a minor crime and that's why they're here. Right? So that is my hope and prayer, because we already have a thriving medical center in our jail, and that's not good. The second thing that I'm going to add just real quick is that I think that we need to start paying people who hear horrendous stories every single day and deal with some of the hardest individuals to deal with at times, and just get this vicarious trauma all the time. We need to start paying those people like we pay scientists, like we pay engineers, like we pay attorneys. We need to really value that, because let me tell you something. Yep, you can be stressed out as whatever type of professional, and it can be a tough day. But if you have a tough day and you're doing 2 or 3 people's jobs because nobody wants to do this job because of the pay, and then on top of that, you keep hearing these horrible stories, and people that don't care don't get into social work, right? It's people who care about other people, so they take this on, and we need to start paying those people.
I have a couple of questions from Facebook. This first one from Lonnie, I think maybe Brenda, you should take a go at this. Is having law enforcers also be social workers an effective approach? You kind of started to get into this. Maybe you want to elaborate a little bit to respond.
Yeah, so having law enforcement as social workers or paired up with social workers?
I think it's as social workers, a little bit of both,
So,
Going
you
both
know, one of the things that I found very interesting in law enforcement is that on people's worst day, when they're having a crisis, they call 911. And if no one's hurt, they don't send EMS. If nothing's on fire, they don't send the fire department. And basically, the only people left are law enforcement, so send them. They're already in the cars, they're already out there, so there you go. And we end up taking care of people that are in crisis, and that is not a good place for law enforcement to be. We have, and just, I've worked with so many incredible law enforcement officers throughout my career, and some that gave, like, you know, some died doing this job. I have 5 friends that died that wore my badge, and it's a hard job, and they care, right? And when they get sent out to deal with people who are in really bad situations, it can be very difficult to handle. Law enforcement officers need to understand how to do so many different things, and some of the best negotiators I have ever seen, some of the best de-escalators that I have ever seen are law enforcement officers, because they deal with it on a day-to-day basis. So I think that, you know, I think law enforcement, thankfully, is going down that route of really better educating our law enforcement officers through CIT training and different things like that. And I think that needs to continue, because we are going to be the ones, law enforcement is going to be the ones that are called when there's a dangerous situation. So we need to be better trained, but we also need to, the community also needs to learn how to work with law enforcement as well, to create the best outcome in that situation.
Thank you. Another question from Facebook says, why doesn't the city take the vacant real estate sitting around and have the homeless stay in these dwellings to keep them from vandals and arsonists taking advantage of them? Commissioner Cruse, do you want to kick us off on that one? Maybe a few of you would like to weigh in on this one.
Yeah, you know, housing is only one piece of the puzzle. Housing is one start. You have to have support. There's a couple of stories that, you know, one story in particular was someone got into a house and, you know, they punched a hole in the wall to see their neighbor next door, because some people don't know how to live in houses. And it's, you know, when you have a persistent mental illness, when you're dealing with a substance use disorder, people need support. The longer you've been homeless, the harder it is to be housed. And it's important to understand those facets of things. And so, you know, I think permanent supportive housing, like what we did with the studios and working with that project with Humankind, Salvation Army is doing some really great things. Those permanent supportive housing options in our community have a 90% success rate nationwide. So the studios just opened, I think, what is this? February. I mean, they just opened in January, so we don't have enough data to understand the success rate, but I think that we're going to see the same types of statistics that we see nationwide. We need more permanent supportive housing. You know, getting someone into a house is one thing, but supporting them while they're there, understanding that they'll need medication appointments, they'll need physical health appointments, they'll need job training and placement, they'll need all of those other aspects to be successful in their home. This is such a complicated thing that I love that we're talking about it right now, but 1 hour, you know, just like tiny tips of the iceberg of, maybe it doesn't, but there is so much to this, but it's not just about getting someone into a house. It's about supporting them when they're there. And that's why the community aspect, back again to, it's everybody, you know, everybody is really on the hook for this, because all taxpayers are paying into this system. You know, the high utilizer study that's on the Mental Health and Substance Abuse Coalition's website talks about, you know, $50+ million worth of care, and then $17 million worth of uncompensated care. So we're already paying for it. and it's not producing very great results. And so that's what we need to get to is going upstream, right? Brenda's talking about upstream, like we're all saying the same things. It's literally just like this report. If we do what's in this report, we're going to see success. And I'm going to plug it again, February 24th. Like, let's talk about this because it's important. I mean, there are plans. There are things that will move the needle. It's when are we going to stop talking about it and start making decisions and start actually understanding that the more we talk, the less we get done. Let's make decisions. And that's what I'm ready to do. And I think my colleagues are ready to do that too. And I'm excited about the support that's happened with city and county officials because, you know, we do see the need for spending this money wisely, especially because it's unprecedented. We haven't seen this kind of money come into our community before. And we have a real opportunity. I mean, this is kind of crazy that we have this much opportunity to not only invest $15 million in a community crisis center, but we'll talk about a social service hub, talk about all of those things, a co-location of services that can move the needle and reduce the amount of time it takes for someone to move from provider to provider. And it doesn't only help the person, but it helps the providers as well. So I talk too much, Sarah Jane. I'm surprised you even asked me on here because I'm long, but I love this. And I'm so excited that we're having this conversation.
Can you share a little bit more detail about the February 24th meeting where people can watch that or go to that or what that will be? And then tell us what you're going to say too. Go ahead and.
Yeah, about 60 days ago, probably, was it longer than that? I don't even know how many days it was, but we had an en banc meeting where we talked about homelessness. We talked about mental health services. We talked about, remember the white lines that were put out at Open Door, that was a big issue because you can't just put white lines on a sidewalk and expect for the problem to go away. So, I'm not criticizing anybody about that. I just think that there are things that we're doing in this community that maybe, anyway, we came together as an en banc. We agreed as city and county officials to have the Mental Health and Substance Abuse Coalition come back with a report about how we're going to move the needle. There are multiple examples around the country, San Antonio being one that we've probably all heard about, which is a co-location of services. There are Oklahoma City, Denver, Colorado, tons of examples that Brenda Dietzman and Misty Bruckner and her team at Wichita State, they have done an incredible job of bringing back the facts and the data and the research around why having a co-location of services needs to be where it needs to be, with access to our jail system, with access to other social service providers, safety net clinics.
Lacey, here's a really good question from Facebook that applies directly to what you're saying. What would you say to those who say all this is a great idea, but not in my neighborhood? How, when we talk about barriers to making progress on these issues, there is some stigma that we haven't really addressed at all this evening yet. But what do you say to people like that? And maybe I should open that up to anyone to respond to.
Well, I'd love to respond to it, and I'll be fast, y'all, because I know I'm long-winded. So it is in my neighborhood, NIMBY, not in my backyard. It is literally in my backyard. Like I see homeless people every single day in my backyard. And if we don't help this problem, it's only going to grow and it's going to spread into every backyard. I hope that it doesn't get there, and that's probably a little overly dramatic, but it is here. In your community, no matter where you live every single day, where you rest your head at night, we have different pockets of our community that make us really cool, right? Downtown, Delano, Nomar, all of the different facets of our community, and we all enjoy them. And so nobody is stationary to their own home, right? Everybody moves around this community. And so why wouldn't we all want to invest in human beings that we're paying taxpayer money for in the first place. So I don't like that, but I know that people say it, but it's literally in my backyard. So I'm like, that's why I'm doing this. I mean, I don't know. I hate that question.
Any other responses to that?
I think one of the things, again, if we can make this happen, I understand that it's got to be in somebody's backyard. But if we can do this and clean an area up or improve it, because I mean, if you go by and you look at the studios, which used to be the 316 Hotel on Broadway, how awesome is that? It looks good. It's clean. It's nice. It's an incredible building. So if we can do that and then create these upstream prevention and rehab areas where people actually get the help that they need, then it's going to be a smaller backyard that these people are in, right? And that's what we want to do. So yep, it has to start somewhere, but if we can help out a neighborhood in doing that, then maybe, we're going to help people. We're going to make a neighborhood look better. Let's do that.
I want to finish with one more around the room question to you all, but first, would you share, Brenda, the time and place of the meeting that's happening on the 24th so that people, or if there's a website they can go to watch it, just the time, place, details?
Absolutely. It's February 24th, and it's going to be from 9 to, we're hoping 11, because I have an 11:30 meeting that day, but it might go a little bit longer. We'll see. And we're going to be laying out the plan at that point, and taking, I'm sure, a lot of questions and hopefully giving some really good answers to
People
those.
will go in person to
that really hasn't been decided yet. Again, COVID. So I know for sure, because this is an open meeting, because both the city council and the county commission will all be in the same room. So it has to be open to the public. It will be on Facebook. I'm sure that a lot of the media will stream it on their Facebooks live as well, and probably the city and the county channel as well. So yeah.
Thank you.
Absolutely.
So now to wrap up tonight, you all, there is, it is such a complex issue. There is so much to know about it, and just it's almost impossible to get past a chunk of that iceberg, of course, in an hour. But as a final question, I'd like each of you to tell us what is something that people don't understand or need to know about this issue. If there's some way to kind of summarize a quick thought for people. And Bernestine, would you like to start?
Yeah, I'll go. But can I just say that, I really appreciate the opportunity to be a voice. And to the commissioner and everybody else on this panel, thank you so much. I have felt such passion. I didn't even know this much passion existed in Wichita. I'm going to be really honest. So thank you so much. But what was the question? I'm sorry.
What do you wish people knew or understood about this issue?
I wish they would educate themselves about the symptoms and how they can help, and also put forth an effort to just get rid of the stigma that goes with an illness that is a health issue. It's real simple. It's a health issue. The other medical conditions don't carry the stigma. So if we could just educate as a community, I think that would be very powerful.
Thank you. Regina?
Yes, I would also want to highlight stigma, that not everyone experiencing homelessness or an episode of homelessness meets criteria for a mental health disorder or a substance use disorder. They may be struggling, and just like us, we have day-to-day stressors and we may need extra help, but please do not automatically call them mentally ill or that they have a substance use problem just because at that time they are experiencing homelessness. And if they are, respect that and help them get the support that they need.
Thank you. Jami, how about you?
I think in all the years that I've been doing this, I have met some of the strongest people that I will ever meet in my life. They have survived more than I could ever dream. And one thing we really need to remember is that it could be us at any given point. We don't know. And, you know, I'm fortunate. I have good supports in my life. I have a good support system. And, but some of our folks aren't fortunate enough to have that. So like Regina said, try and get them help. If you don't know where to get the help for them, call one of the providers. We will get you to the right person. We will do what we can to get that person help.
Thank you. Commissioner Cruse?
I would say that we need to just realize that we're all on our own path. And over the past, couple of months, just talking to a therapist myself, understanding that my brain works in different ways. And I think I like to share my own personal story because I think it's important. That to me is reducing the stigma, is sharing my personal story, sharing the things that have happened in my own life and with my family members, because I am a lot like every person that I come across day to day. Yeah, I have differences than others, but quite frankly, I am on a different path than other folks. I do operate in a different way than others. And I say but really I hope that people get it, that you are unique, you are individual. And some people have a mental illness that maybe makes them not normal to society, but that's the way they function. And that's how they give their gifts to the world. And I think that it's important for us to realize we have different gifts and to embrace those. We aren't all the same. And that's what makes us beautiful and our community thrive is our differences. And mental illness and substance abuse is probably one that we need to really focus on if those around us experience that. But just realize we're all unique and embrace it.
Thank you. Brenda, last words go to you.
Yeah, I think there's one thing that I'd really like to put out there is that there are trained professionals, these folks that you see on this panel right now, that understand how to treat, how to help folks who are in need. And I'm gonna have a hard conversation with y'all right now, okay? When you take, I know, when you hand somebody a $5 bill when you're sitting at a stop sign because they've got a really cute sign that pulls at your heartstring, you are probably not helping them. There are studies from all over the United States that says that a vast majority of that money goes for drug and alcohol, or it's somebody that doesn't need it, right? It's somebody that's going to go and jump in their BMW because they don't have to pay money on that or pay taxes and all this other stuff, right? It's easy money. So please understand that there are trained professionals, there are trained organizations out there that know how to help these people and know the science behind it. If you want to give $5, give $5 to the United Way, give it to Open Door, give it to Breakthrough, Humankind, I don't care, right? But give it to somebody who knows how to use that. Putting a bunch of sandwiches together, again, hard conversation, but I've been around this. Putting a bunch of sandwiches and going down to a park and handing out sandwiches to people isn't helping. It helps them for that moment, right? It gives them the fish, but it doesn't teach them how to fish. And when you drive them to organizations like the Lord's Diner and places like this, these people have case managers. These people have resources that can help these people long term. So please, 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 let the professionals do this. Support them. If you want to help, call 211 and say you want to volunteer. They will take you through a questionnaire that gets you to something, a volunteer opportunity that you can be passionate about. It might be one of the local nonprofits that are helping these people. And then you can learn better how to help these people from the pros. So please, I know this is hard conversation, and this is Brenda talking. This isn't anybody else talking. I love people that have incredible hearts, and thank you, and God bless you. But let's, as a community, really focus on getting people the help that they need. Call 211, get a volunteer opportunity, and then really learn the science behind this, because that's what we need in this community, to get people the help that they actually need.
Thank you, Brenda. And thank you all for such an interesting discussion. I hope you've enjoyed our program. This Engage ICT conversation is sponsored by Susan and Leon Mader of Mader and Associates. I'm Sarah Jane Crespo. Thanks for joining us, and tell your friends and family that they can watch this conversation on our website, kmuw.org, under the events tab, or on Facebook.